The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Hopefully everybody's having a marvelous day today. It's sunshiny where I am. I hope it is where you are too. Paul assured me that it's not sunny where he is, so maybe we can send some of that his way. Welcome to the DBHR Topical Employment Webinar for the month of November. The topic being IPS Fidelity and Documentation Requirements. Presenter is going to be Paul Phares, who is coming to us from Illinois. And we're hoping today, after he does his presentation, that people will have questions. So do please feel free to use the chat box, to raise your hand, or whatever way works best for you in order to participate. But this will be a participatory kind of a thing, with definitely questions to be asked at the end. Thank you for attending, and I'm going to turn it over to Paul.
Thank you, Dawn. Good morning, everybody. As Dawn said, we're going to talk today about fidelity and specifically the documentation requirements surrounding the IPS fidelity scale. I was telling Dawn earlier, for the time allotted, I typically would come in with many, many more slides, but this topic is such that there is kind of general guidelines available for IPS providers with regards to which documentation or which documents they can have to record their program's progress. But ultimately, each IPS provider has to make decisions about how they document it and what that documentation looks like. So what I have today, I never really know, as far as the crowd goes, how many people know everything about IPS and how many know a little bit and how many know somewhere in the middle. So I am going to start off with just a couple slides of review information. And then I'm going to kind of get into the nuts and bolts of documentation requirements where I show some examples and then kind of direct you to a website as well where you can get, I think, a lot of questions answered for sure. So without any further discussion, let me go ahead and get started. So the agenda, like I said, is very modest. We're going to do a quick overview of the fidelity scale just to kind of level set. And then I'm going to talk briefly about the process of a fidelity review. So if you're an IPS provider, you can expect at some point to have fidelity reviews happen in your organization. So I wanted to kind of give you an idea what that is looking like, and then we'll talk about, as I said, the specifics of the fidelity documentation. Just a little context, I like to put this out here when I'm doing a webinar. Things I'm going to talk about aren't necessarily Washington specific. I'm going to talk about best practices and common approaches, organizations that have had good outcomes and have been doing this for several years. And then again, most of what I'll talk about is really driven by the IPS fidelity scale. And again, if you don't have a copy of the IPS fidelity scale, I encourage you to get a hold of one because that is exactly the playbook that a fidelity reviewer will use when reviewing your IPS program. So let's talk briefly about the fidelity scale overview. Really, the first question I like to put out there to folks is why is fidelity necessary? And if you think about IPS as an evidence-based practice, what fidelity assures a provider or a fidelity reviewer or a payer is that the provider who is performing IPS services is doing them in the manner that the evidence-based practice intends. So the IPS fidelity scale really has these critical elements and principles of IPS and says, here's the gradient that we would consider fidelity. It's also important because high fidelity programs, they typically have much greater effectiveness than low fidelity programs or programs that don't have any fidelity. So if you think in terms of outcomes, which would be, job starts or employment, those sorts of things, those are great outcomes, and you can almost get to a point of predictability with high fidelity programming. Primarily, certainly we want to use it to improve the quality of our IPS programs. It's necessary at whatever phase you are in IPS, whether you're just starting IPS in your organization, whether you've had it for a few years and you're wanting to get better, or whether you're already at a good place from the fidelity perspective and you want to keep it there, that monitoring perspective. Other uses, it is absolutely vital to train employees with, being that it's the playbook for us to set the stage, if you want to think about it that way, for IPS services. As you bring a new employee on board, we should be directing them right to the fidelity scale with questions, and maybe the discussion about how our organization implements that item. In general, just general items about Fidelity, 25 items. Each item is rated 1 through 5, and they break up each item into sections, one being staffing, another being organization, and another being services. And really, the Fidelity reviewers come in for a day or two, and they use a combination of interviews, reviews of clinical documentation, and observation of activities to really try to identify a score for each item. IPS, one of the things it aims for is these core principles on the left. And the idea with Fidelity is that the items, those 25 items, correspond to principles on the left, and the points you get for each item really kind of sum up into a total Fidelity score. That total Fidelity score on the lower right, it correlates to a level of fidelity for your program. So the lower part of the Fidelity scale would be fair fidelity, kind of in the middle would be described as good fidelity, and then the top tier programs that get the highest scores would be regarded as exemplary fidelity. And the overall process kind of follows this cycle. So on the upper left is, you implement IPS, and after a 12 to 18 month period, you get a fidelity review, which tells you your score. You take that score and you move to the lower right into fidelity planning, and you're planning with your team and your organization on how you can change things, adapt things, be more flexible here or there in order to increase your fidelity score. And then after another 12 or 18 months, you get a subsequent fidelity review, and it just goes over and over again, where you're using your score to plan for the next fidelity review throughout the entire process. So I talked about the fidelity review, and I'm just going to talk kind of in generalities about the fidelity review process, because each state kind of has the latitude to implement fidelity reviews in whatever way they, A, have the ability, B, have the capability, and C, kind of have the interest in doing. So this is just kind of an idea of how my home state, Illinois, does it, and we've even tweaked it over the years a little bit from here. But so in general, fidelity review, you can plan on at least 2 days and at least 2 reviewers. In Illinois, we use 3 reviewers. But the idea is the reviewers use the Fidelity Review Manual to guide their interviews. Each reviewer has their own style, but all of them follow the manual in an effort to have consistent scoring. Some of the things they observe are team meetings, employment specialist calendars. They might interview staff on the IPS team or staff that are not on the IPS team, like a counselor or a therapist, for example. They interview clients or customers, the voc rehab counselors, benefits counselors, etc. Reviewers also observe job development. So if you're an employment specialist on the call, you might think about how in a fidelity review, how you would schedule a reviewer to shadow you on job development. And we can talk about that if you have specific questions about that. Some people think that that strikes them as strange, as something that they hadn't counted on in a fidelity review, so I'm happy to talk about that later if we have time as well. So things to plan for, the team of reviewers, certainly, you want to have space, right? If you've got a conference room or something like that, that's a good place for them to have home base. Think about chart access for reviewers. Some agencies have paper charting, and that's fine. Other places have electronic medical records, which again is fine. But often to request access for somebody who's not an employee can be a challenge. So that might mean your agency has someone kind of driving the computer, is what we call it, for the reviewer, so they can review a record. It's important to consider adequate space for all the activities that you would need to have the reviewers observe over the 2-day period. So that includes team meetings, individual interviews, client interviews, etc. And then, like I said earlier, the shadowing of job development. Sometimes people really struggle to conceptualize how that could work. So the reason there's at least 2 reviewers, and in Illinois we've moved to 3, is, we use what's called a consensus scoring method. So the idea is if Dawn and I are going and doing a fidelity review and she thinks somebody scores a 4 and I think it's a 3, we have to try to kind of negotiate and talk with each other about why it should be one score or the other. That third reviewer is helpful because often it's kind of majority rules and nobody really gets outvoted or anything like that, but it's a way for us as reviewers to all agree that yes, I can get on board with this score. It's important to remember that with fidelity scoring, there's a gradient between the scores that shifts as you get higher scores. So moving from a 1 on any item to a 2 is pretty easy and automatic and easy to see. Often that is, a score of a 1 is because there's an absence of an item, and once there's a presence of the item, you can get a 2 for a score. If you contrast that with the difference between a 4 and a 5, often the scoring between a 4 and a 5, there's nuance involved, and really reviewers try to reserve 5s for the ideal state and ideal circumstances. So there is a much narrower margin between a 1 and a 2 than there is between a 4 and a 5. And that's really where a lot of discussion ends up happening for reviewers. It's also important to know there are some items, if you look at the fidelity scale, where there's an auto score. If your team size is 1, you can't get above a certain score. If your IPS supervisor does 3 of the 5 things instead of 5 of the 5 things, you can't get above a certain score. And then there are a few items that require calculations, averages, rates, that sort of thing. So it's all important to understand how each item is scored, as in addition to that each item is scored. And now let's talk about fidelity documentation. I'm going to try, even though I don't have hundreds of slides today, I'm going to try to move through these items slowly, just to explore things with you. And then again, I told Dawn that we do want to leave room at the end for folks to ask questions. It's very important to me that you kind of come away from this feeling like you got what you needed. So the first thing I will tell you all is, if you don't know this website, this is the IPS Employment Center. They have an entire research library full of resources. It's all free. This is run by the individuals, the group of people who created IPS. If you don't have this saved in your internet favorites, I encourage you to do so. Whenever agencies have questions about fidelity, this is often the first resource we consult, because they really wrote the book on IPS employment. And you'll notice here the last line, the text in green on the next several slides. These are things that are available at that IPS Works website. So just to make a mental note, if you see something green, it's on the website. So you can make that note. And then also, one of the things that Dawn and I do after these webinars is I make the slide deck available to folks if they want it. So Dawn can send that out afterwards. So let's just start with just kind of overview conceptually phases of documentation. So now there's a fidelity scale if you didn't before. Now, if you didn't before, how reviewers kind of approach a fidelity review. And if you think about it from the perspective of a fidelity review not really being like a survey or an audit, it is more of a way for reviewers to understand your program so that they can make recommendations on how you can improve your program. Then it's a little bit easier to think about what you need to document. You need to document the evidence that shows you're in fidelity with the scale. And it's important to keep it in mind through all phases of employment. This is really a good way to package it in your brain. Is you need to document everything from intake to engagement to assessment to placement to coaching to follow along support for your IPS team. There are a few things beyond this that you'll need to document that are kind of organizationally, indicators, if you want to think about it that way. But in terms of your IPS team, if you can have good documentation that shows the flow of traffic through all phases of employment, you're going to be in pretty good shape. The types of documentation you're going to be looking at, I tried to lump these into sections for you to think about it that way and compartmentalize it a little bit. There's going to be documentation that you create or you have in your organization that is client or customer specific. So those are going to be the things that when the reviewers show up to your organization, you're going to find in a medical record, in an IPS chart. They're typically going to be the things that have a client or customer name on them. So that's everything from vocational assessment to progress notes to work done with a specific client in your IPS team. There are also going to be types of documentation that I don't know if I like this is the best term, but IPS team performance or function. So a lot of that is going to rest on the shoulders of the IPS supervisor. A lot of that is going to feel like tracking documentation. You're going to want to track things like number of job development attempts each week. You're going to want to track caseload size for each of your employment specialists. You're going to want to track the number of days between a job start or between a person being open to the program and their first face-to-face in front of an employer. So those are things that it's important to know. They're not going to be in a medical record, though. They're going to be in some other sort of form in your organization. I mentioned a few minutes ago kind of organizational documentation as well. This is going to be high level. To me, these are metrics that gauge the culture of an organization and like the culture of work. So, for example, there's an item in the Fidelity Scale that identifies that agencies, in order to have a 5 on this item, agencies must track the rate of competitive employment for all of the clients in the organization, not just IPS team. And so if you're an agency that does not track that, you can't get above a certain point value. But that represents the culture of work in an organization, as do the other data points in that organizational kind of bucket. And then there's some other things that they're just good practice. They're not necessarily employment specific, but they could impact either directly or indirectly your overall Fidelity Scale. And I'll get into those. Some of those are things that hopefully your organization is already doing. So I'm going to start in that client or customer specific zone there. And the first thing, that's really important for you all to know is, and again, this is in green. So remember, this is available on the IPS Works website. The career profile or vocational assessment, people kind of call it both things. So in the Fidelity Scale, a couple things to remember. It really talks about, this should take place over 2 to 3 sessions. The preferences, identified here in the vocational assessment, they need to match the job search plan. So if you're doing a vocational assessment and somebody says they have an interest in working in food service, and then the reviewers come in and look at the job search plan for that client, and we're searching for a job in retail for the client, reviewers are going to ask a lot of questions about why that is. The idea should be that when somebody identifies preferences, what they want to do for work, that our employment teams are helping them find exactly that sort of job. Other things that, documentation that we would expect to see are multiple disclosure discussions, kind of that evidence of a disclosure discussion over time. And as you may or may not know, disclosure is really the idea that you're talking with the client about whether or not they want to reveal to a potential employer if they have a mental health condition or if they're working with an IPS team. And that is entirely the client's decision. But the idea is that their opinion changes over time. It may be, they may have one opinion for this employer, but a different opinion on disclosure for another employer, which is why we really want to see it over time. And so a really good way to kind of get at this from a documentation perspective is there's a pros and cons sheet on disclosure on the IPS Works website. It's really well laid out, and don't reinvent the wheel. It's a great thing to kind of start the discussion with at the beginning and then update it as you go along. Other things that we might find that show a reviewer that disclosure discussions are happening over time would be a release of information in the chart in order for the employment team to share information with a potential employer or an employer. So, again, one of the challenges I think I had with putting this slide deck together is there are so many ways you could do some of this documentation that there literally is not enough time for me just to show you form after form after form that you could use. So I'm trying to keep it high level. You heard me mention job search plans. There's a few, I believe, available on the IPS Works website. And again, these should be updated. These should be revisited. They should match the preferences in the career profile. But if we keep using that metaphor and the client says they're interested in food service, we have a job search plan where we're going and looking for food service employment for them. Let's say they get employed at a restaurant, they try it out for 30 days and they hate it and they quit. Well, then we would expect the job search plan is updated with something, different, whatever the client's choosing. So if they decide, well, food service wasn't for me, it's too fast paced, I need something more slow. I still like customer service, but there's too much bustle in a kitchen. Maybe then the job search plan is updated to, something else. Working at an auto parts store, for example, where maybe the traffic isn't like a lunch rush or a dinner rush. It's maybe a slower pace all day long. There's still customer service. We would expect to see that in the documentation on the job search plan. Benefits planning, once you go through benefits planning with a WIPA trained benefits planning resource, often they give you a specific kind of statement of benefits for the client, and that is the perfect documentation that you've done benefits planning. If you have a copy of that in the chart. Also, we've seen, progress notes that identify, went with Bob to his benefits planning appointment, and you've got all of the detail there in the note. I think it is a good idea for IPS programs to have some sort of financial idea of how the client's benefits are impacted in their record. And I say that because it is not uncommon for some people to lose paperwork we give them or to misplace it. But the idea being, if you're the employment specialist, it's ideal for you to be able to go reference a statement or make another copy of the statement on how their benefits change because of employment income. So it's kind of a backup if you want to think about it that way, but it's a really good idea to retain some of the financial information there as much as you can. A job retention plan. Once a client gets employed, we would expect to see a job retention plan. And that's exactly what it sounds like. What do we need to do in order to help somebody, support somebody to retain their job? That gets updated as things happen and change, and maybe people change positions or add more hours or reduce hours. And likewise, a job ending form would be something we could look at. That would be once somebody has ended a job, we identify the reason for termination, which would cue us to go back and update our career profile and our job search plan. There are agencies that have the job search plan, the job retention plan on one form. Think about how that might work for you. There are other places I've seen that have job retention, job search, and job search, job retention, job ending, all on the same form, kind of a checkbox sort of form. All are okay. And that's what I mean when I say agencies really get to decide how this works best for them. If you have questions about, what is out there, please ask them at the end of the call. Again, IPSworks.org has a ton of things available that we're talking about today. Now I'm going to shift gears and kind of go into that IPS team performance function. As I said earlier, a lot of this really is IPS supervision related. And it is a lot of these things are ways for an IPS supervisor to monitor the performance of their team or the function of their team from a fidelity perspective. So in the fidelity scale, minimally, we would expect to see that an IPS supervisor is providing supervision to the employment specialist. That can be available individually or in group. But the idea with this IPS supervision is that there are performance targets that are discussed and kind of evaluated on a regular basis. And so, often organizations that are high-performing organizations have an IPS supervision sort of form that they've created, wherein there's a place to put targets on there. There's a place to evaluate performance against those targets, and that just goes in either an employee file or in kind of a big binder at the organization that a reviewer could look at during the fidelity review. Other things to think about from a performance or function standpoint would be, just in general, a caseload list. And so we'd want to see all employment specialists, all the cases assigned to each one of them, including employment status, which team referred the client to the employment team, length of time working with the IPS team. And these bullet points here are all in the fidelity scale, and they're spelled out there pretty easily. So, the caseload list, just to give an example of the importance of a caseload list, one of the first things that a fidelity reviewer is going to do when they come into an organization for a fidelity review is say, can we see the caseload list? And primarily there's an item that, employment specialist staff, or team assignment rather, each employment specialist can only be assigned to up to 2 teams from where at least 95% of the referrals are generated. So real quickly with a caseload list, you get a peek you can answer and score one item right out of the gate as a fidelity reviewer. So it's to your credit and advantage as an organization to have as much documentation as you can put together to allow a reviewer to identify how you're doing the work. Supervisors are required to do job development mentoring, where they go out and observe job development for employment specialists. I believe it's at least quarterly, with the idea that you're just identifying strengths, identifying opportunities. We would expect that a supervisor is doing more job development mentoring with a brand new employee than with someone who has been there for several years doing that job. And so, again, some agencies have forms where they put all of this down. Often other agencies have this incorporated into their supervision form, and the supervisor bundles the individual supervision of the employment specialist with a mentoring opportunity. And so, again, flexibility is here with how you do it, but it just needs to be done in order to be scored.
Mm-hmm. Paul, I'm sorry, Paul. I see we have a hand raised. I was going to unmute Jamie in order for him to be able to ask his question. Is that okay with you?
Sure.
Okay.
Yeah, totally.
All right, Jamie, at least from this end, you're unmuted.
Awesome. Thanks, Dawn. Hey, you're talking about these different supervisor logs and forms. Are there examples of those that we could access somewhere? Or is it kind of create your own?
Well, so it's there are some examples on the IPS Works website. Just as a spoiler alert, I do have a couple examples I'm going to get to in a few slides. I can show you how other places have done it. But at the end of the day, it's got to be, you have to make it what works for you, I think would be the short answer.
Right. All right, cool. Thanks.
All right. Good question. And to your point, I mean, the last thing I wanted to do was have a webinar where I just, instead of information, I just show you a form. And there's a why behind the form. So that's kind of where I'm trying to start with all of this. The job development logs is basically a log of the work your employment specialists are doing to go out into the community and talk with potential employers. At a minimum, we're going to want to see the number of job development visits, whether they're face-to-face or not, whether it's with a hiring manager, whether it's client-specific versus general. If you can kind of hit those marks, your job development log should be fine. And then it's just a question of, are you hitting the volume that the fidelity scale says we need to be hitting, and then it's easier to score. And then another thing that agencies often overlook is, we really try to get a bead during a fidelity review on what percentage of services are performed by the IPS team out in the community, not in the agency, but outside in the community. Agencies have done this a variety of different ways. For folks with an electronic medical record, it's a little bit easier. Often with an electronic medical record, you can just kind of put a report together for certain staff, and it shows, whether they're off-site or on-site. For paper charts, you can review things like progress notes. And, for example, you might do a count of 10 or 15 progress notes, and out of 10 or 15, how many were performed off-site, outside the agency. And then if you don't have an electronic medical record and you don't have evidence in your chart, you could do a look at employment specialist calendars. It's not the most scientific, but as a fidelity reviewer, I don't ever think that people would fabricate data just to get a fidelity score. So if you don't have anything else, you could look at if employment specialists are carrying like a planner where they put Monday morning I'm with Bill, and then I'm with Jane, and then I'm with whoever, and those are all at off-site locations. I would count those as off-site based on the calendar item. And then if your organization does have automated electronic billing, if you're billing things, often there's a modifier, and I don't know how it is in Washington, but often there's a modifier for on-site, off-site for service activities. So we have seen agencies that don't have the EMR, the charts, or the calendars that we can really lean on, but they've been able to produce a kind of a billing run or a billing report for a time period for employment specialists that shows their on-site, off-site services. So that's worth noting as well. One of the things I'm going to show you in the next couple slides here is this kind of notion of an IPS supervisor tracker. but there are, if you look at the IPS supervisor section of the Fidelity scale, there's an awful lot of kind of items that a supervisor really needs to kind of have their eye on. And so agencies that are high performing that I've seen have kind of put all of this into a master tracker where, it takes work. You have to enter the data and you have to keep up on the data. But the idea is at any given time, you could pull this tracker out and have a snapshot of who's doing what and where and how often, not just for the IPS employment specialist, but often for the program and then from a client-specific perspective as well. But some of the things that are on these trackers include, all clients, whether they're employed or not employed, the date they got open for the IPS team, their first meeting with the employment specialist, first face-to-face with an employer. If they're employed, we'd want to see start date, job type, employer, wage, hours per week. And this should say if not employed, but if not employed, face-to-face contact within, if employed, face-to-face contact within 1 week before starting a job, within 3 days after starting a job, weekly for the first month, and that is lifted right out of the Fidelity scale, as is outreach attempts over time. So just an example of some of the kind of data tables or trackers that are out there. And these aren't proprietary or anything like this. And these are, as you can see, they're all Microsoft Excel or Google Sheets sort of documents. And again, you have to make it work for your organization. So these are just some ideas. So there are 4 examples here. And let's see here. The one on the bottom is one that has like 6 different tabs to it. I just kind of clipped out a little bit for you to see. But it depends on how you want to do it, right? So you can make the document work for you. So on this top one, you've got the client first name, and these are all fake names and fake employers. Employment specialist assignment. If there's a case manager, like a mental health team, case manager or therapist, you want that name there. You can record the first meeting with the employment specialist, the first face-to-face employment contact, and then this next column, days between first employment specialist meeting and first employment face-to-face. That column is a specific item in the Fidelity scale that is in order to score it, you need to know that the average, like the number of days. And so the organization that put this together set it up so that there's a formula that calculates this, and it's very easy for a reviewer to just look at the numbers in those cells and say this is the average number.
Hey,
so
Paul.
Again, think about,
I have another question for you. This one's actually typed in. It says, how important is it for the actual supervisor of the staff to be the one doing the tracking? They have a program coordinator doing that instead of the supervisor at this point in time.
Everybody sets it up a little bit differently. And job titles can mean a lot of things. A lot of organizations have an IPS supervisor whose job description is something else. So I think, again, I will default to you have to make it work for your organization. And I guess as a reviewer, the way I would answer that question is, so does the supervisor have to, record this data? Not necessarily. But if there's a program coordinator, I think you said, that's recording the data, I would want to look and see, does the supervisor get that information? And if so, what do they do with it from a supervision perspective? So, the idea of this is these are all in some way, shape, or form indicators of how well you're doing IPS. And so the score for the Fidelity scale is for the supervisor, the IPS supervisor. But if there's somebody else in the agency that produces information for the supervisor, I don't think I have a problem with that.
Makes sense.
And if I was the supervisor, that's probably what I'd vote for, is for someone else to do it.
Yeah. Oh, yeah, definitely. Enough on your plate.
Yeah, exactly.
One other person, Tori, had said that she was going to be listening but not able to watch slides. And I will, Tori, the slides will be coming out to you. There's actually going to be a recording as well of the webinar that's going to go out to anybody that registered. So if there's something that you missed, you're able to go back and listen to it again. So that was the other question.
Great. So continuing on the top form just a little bit there, number of months in IPS shows you long-term follow-up supports, right? Certainly a status, number of jobs, open with vocational rehab, that's important to know. If you move to the next example, it's kind of a variation on the theme. This one has some specific job data though, so you've got the employer, which is good. The reason that column is good to know as a supervisor is there's a Fidelity scale item about, gosh, I'm blanking on the name of it. it's diversity of employers. So I know there's only 3 here, but if you had 15 cells here, and in the employers you only had John's Bakery, Toy Shop, and Sylvia's Grocery Store, reviewers would look at that and say you don't have very good diversity of employers. You're kind of going back to the same employers over and over again. So having the actual employer listed is a really nice way to prepare for a Fidelity review. So I like that column. Same as job description or job type. Diversity of job type is another Fidelity scale item. So if, again, you had 15 cells here and all of them said cashier and stocker, we would say you don't have very good diversity of job type. You know, maybe you're not doing it on purpose, but it seems like a lot of the clients coming to your IPS program end up going into cashier or stocking jobs. And we think, you know, the world of competitive work is more than just those 2 job types. So that's a way to kind of monitor that from a supervisory perspective. The starting pay and hours per week are good to have there. Same with start date, end date, months employed. Moving to the third section there. Again, variation on a theme. You can see just kind of a different way to provide some of this data that was up above. I don't think there's anything that really sticks out to me as different on this one. The one on the bottom, that's a way to structure. The reason I put this here is that's really a way to structure I think the last thing I said. Yeah, this part right here. If employed, face-to-face contact within 1 week before starting a job, within 3 days after starting a job, and weekly for the first month. That's tough to track if you're only going to rely on progress notes. So the organization that put this sheet together, and this is a very busy file. This is the one, as I said earlier, has multiple tabs on it. And it's really, they use it like a database for their employment program, which is great for them, but every agency is different. So this one really tracks exactly what I just talked about: the hire date, the first face-to-face before the job start. You know, did we get the job retention form signed? Start date, first face-to-face, 1 week after job start, et cetera, et cetera, et cetera. And this even has benefits conversation / appointment on there, which is another nice trigger, a nice cue for organizations to really hardwire that behavior. The last group of things to document are those organizational documentation. So things like in the Fidelity scale, the Fidelity scale says basically the organization has IPS Fidelity items embedded in their quality assurance program. And so there's a million different ways you could do this. The language in the Fidelity scale says, you know, it has to be items from the Fidelity scale. So, you know, just saying, you know, job starts, for example, if you just measure the number of job starts in your QA process, that might not be enough to get a 5 because it's not necessarily the Fidelity scale item. However, if you lift specific or a suite of Fidelity items out of the scale and measure them in your quality assurance program, that is a way to really, again, hardwire that QA score and behavior in your organization. And again, it looks so many different ways, primarily because there's 25 items and each agency, you know, has strengths and opportunities in their own items. So the agencies that do very, very well on some of those items, they don't have those items in their Fidelity or in their QA report. Often they have the things they struggle with in the QA report. And depending on how your organization works, embedding something you want to work on in your QA report is a way to escalate it above the IPS team. Maybe get executive leadership involved in efforts to increase the Fidelity score for the IPS scale. You know, some places the board reviews the QA report, like a scorecard for the organization. So as an IPS agency, if you're doing more things than just IPS, often what happens is some of the you know, other things are getting a lot of attention in the QA report, and having IPS in your QA report is a really good way to just elevate it in your organization. The Fidelity scale also wants to see evidence of executive support for IPS, and again, this can look many ways. This can be an agency-wide email. This can be written evidence. You know, there are agencies that do a podcast, and it's really cool to hear an agency podcast where the entire podcast episode is the CEO or executive director talking about how IPS really supports the mission and values of the organization. So that's awesome. Agencies have done blogs, you know, really, again, you name it, and it's out there somewhere. But the idea would be that the executive director or CEO is telling all staff, not just the employment team, but all staff about the importance of IPS in the organization's mission. Other things in kind of that catch-all, other organizational type documentation, the Fidelity Scale specifically asks if organizations measure the rate of competitive employment, and that would be all clients served, not just IPS clients. And then it specifically asks whether or not the rate of competitive employment is reported out to all staff. So some agencies use this item to satisfy the IPS and quality assurance. So one of the IPS items they have in their quality assurance report is the rate of competitive employment for the entire organization. So again, a lot of ways you can do it. And some agencies have a very good capability of knowing this, others don't. A tip I would give you is, talk to your support staff, that kind of administrative support staff, the people who are registering clients for your organization. Often employment is something that gets asked the first time a client comes into your organization, and often that's something that needs to get reviewed at least annually by support staff. So you might know this information in your agency, or I shouldn't say that, you might have this information in your agency, you just haven't pulled it out in a report yet. So that's a tip I would give you. Newsletter, brochures, posters, signage, again, in the Fidelity Scale, it really identifies some of these things. These are really the evidence of the culture of work they talked about. The idea for the newsletter, the brochures, posters, signage about IPS is that employees, certainly, even folks who are not involved in the IPS program, would kind of know that it's available and want to refer to it and understand how it connects with the mission. But then also clients. Often when you go to a Fidelity review and you interview clients and their families and you ask them how they learned about the employment services or the employment team, one of the things you'll hear is that, they were in the waiting room and they saw this brochure, so they picked it up and started leafing through it, or they were waiting to see a doctor and they saw this poster that said you could work, and they'd never really thought about working before, and it got them thinking, and they mentioned it to their case manager, and then bam, here's a referral. So keep in mind that anything you do to put an individual field for the clients we serve is going to help get you referrals. And the research for IPS is one of the most well-researched evidence-based practices for serious mental illness. Research absolutely supports it. There are some other things that are worth noting that they don't fit into the other categories. And again, most places do these anyway, just because of the way they do business. But progress notes, those are technically, that's documentation that will be reviewed at a Fidelity review. And again, each organization sets up the format of a progress note in an entirely different way, and that's all okay. Agency intake forms. So a lot of organizations get tripped up on a Fidelity Scale because the IPS team will do an intake, and of course that intake has all kinds of questions about interest in employment. But the Fidelity Scale is actually asking about the agency intake, not just the IPS intake. So if your organization has kind of multiple layers of intake, it's really important for you to think about how you could put employment questions on the agency intake to identify people who have an interest in employment before they even get to the IPS team. Several agencies have multiple departments, multiple teams, and it's not uncommon for each team or each department to have their own kind of a version of an intake. So again, if you think about elevating IPS to a higher level in an organization, a way you can do this is to have employment at the very first touch a client has with your organization. Even some agencies who do phone intakes have taken to making part of that phone intake sort of employment related, a couple, 3 questions to really try to capture those folks who have an interest at that very first touch. And then other documentation that's worth noting that will be out there in a Fidelity review are things like meeting minutes or notes from a mental health team meeting, or other, whatever the other teams are in your organization. Any minutes or meetings from vocational rehabilitation meetings. And then certainly meetings within your agency where IPS is a topic. Those are things that are good for a Fidelity reviewer to see and to know about. And they look different in every organization. I wish I could show you a million examples of these, but again, there are just too many to even start to whittle it down. So that really concludes kind of my content, and I'm happy to talk through questions people have, or fears. I'm sure there are some of you out there that haven't had a Fidelity review yet, and I'm happy to talk with you about that. So by all means, this is your time to get your questions answered.
Okay, and let's see here. Linda said, if an item is not applicable to our organization, for example, we're not affiliated with a mental health program, so we have no mental health treatment teams, will we score 1s on that item and end up with a low Fidelity score, or 5s, or will that item just not be counted?
Great question. And so let me provide a little backdrop before I answer it. So the IPS Fidelity scale was all written and researched with adults with serious mental illness in mind. And so what has happened over the last 20 or so years, as research continues and as other populations are identified that can benefit from IPS services, what we're finding is that the Fidelity scale, while constructed for a specific population, is applicable to many more than just adults with serious mental illness. For example, youth with mental illness. In Illinois, we've got now kind of 2 Fidelity scales. We've got the adult Fidelity scale, and we have a Fidelity scale that incorporates additional Fidelity items for people who serve youth. So while I can't read the future, if I could read the tea leaves, I would guess that at some point the scale will have to become a little less specific with mental health in order to really identify and evaluate the many, many ways that other people are using it. So one of my favorite examples is the VA has done extensive research on IPS and its suitability for veterans, period. Not veterans with any condition or anything like that, but just veterans re-entering the workforce. And it's shown to be widely effective, as you might imagine. So in a similar way, an agency that's working with veterans and trying to help them find jobs through IPS services, they would have the same sort of question, what do we do? Do we ignore it? Or, we don't have a mental health team. Here's the way I would answer, and here's the way I would kind of think about it as a reviewer. You must be getting your referrals from somewhere. There are some agencies here and there where people walk in the door and the only service available is IPS services. And that's maybe the minority as opposed to the majority. But for the majority of IPS providers, there's some other sort of team or group of clinicians or group of workers that refer clients to the IPS team. And so I would consider in a Fidelity review, whoever that team is for you, to be the team that you integrate with, to be the team that you sit in meetings with, to be the team that you help think about employment for clients that haven't yet identified an interest in employment. And again, it could be a lot of different things, what that team is. And I'll give you an example. I went to an organization one time and they had if you're familiar with kind of the clubhouse model at mental health centers, this was a freestanding clubhouse with no affiliation with any mental health center in any way, shape, or form. But this clubhouse organization decided to start an IPS team. And so the reviewers really had to kind of stretch our brains out a little bit with it, because what ended up happening was the clubhouse staff were the ones referring people to the IPS team. And so we really ended up regarding the clubhouse staff as that quote unquote mental health team for the purposes of the Fidelity review. And hopefully that answer makes sense. It's a long answer, but.
Well, and I'm going to add to that, Paul. Within the state of Washington, we have a lot of data. The programs that are doing IPS are foundational community supports programs, contractors who are doing supported employment per IPS. And if you look at the data for foundational community supports and the people receiving services, 94% of them have or have had a diagnosed mental illness, whether or not they're receiving current treatment for it. And so as Fidelity reviewers, we've pushed agencies to connect with the mental health agencies that are providing services to people and try and draw them into that team. They're not going to be in close proximity to them. That's part of one of the principles. They're not going to do probably weekly meetings with them. That's, part of one of the principles too. But to do periodic meetings with them in order to be able to collaborate services for the person and be in as close a contact as is possible. So that's one of the things that we've talked to agencies about, is if somebody is receiving mental health services, you really truly need to be contacting that mental health agency and trying to kind of pull them into what are they doing with the person? How can we collaborate? What can we do that's both of benefit to the individual? I see Linda also ended up saying, you're talking about VR, and she says that's the case of our organization. We're a voc rehab program, and clients are often self-referred. And then she says, or they are referred by other agencies that have declined serving them. So we have the variables are all over the board here with kind of the way we've been implementing IPS with FCS agencies, with foundational community supports agencies.
And a quick side note too that I think I left out, Dawn, was, a Fidelity reviewer is not coming to your organization to dock you points or score you the lowest score possible.
Right.
Fidelity reviewers, if they're doing it the right way and in the spirit of IPS Fidelity reviews, what they're trying to do is really understand your organization over that 2-day period so that they can give you the most credit possible, not to fake fidelity or anything like that, but all of these innovations and unique characteristics of all of the organizations we've talked about are all ways that IPS can be delivered. And just because it's not a mental health team doesn't mean you're not doing good work. And so we want to make sure we accurately portray. Yeah, we want to make sure we accurately portray the work you're doing so that we give you the fairest score possible. Again, there's no reviewer that's going to come in and say, well, sorry, you don't have a mental health team, so therefore you get, 0 points. There is a team, but it's going to be up to each of your organizations to identify it to the reviewers so that we can understand how you interact with some of these other places. And whoever said, Dawn, that, they get kind of self-referrals that come from other organizations that don't want to serve them. The first thing that, I thought of with that is that's a natural agency to go reach out to. If they don't want to do the work, you're a great partner for them because you can do the work they either can't do or don't want to do. And that might be a referral source that really pays off.
Mm-hmm. Mm-hmm. And might be somebody that you pull into that, not so much treatment team, but support team. So maybe they're providing another service, but not supported employment.
Right.
You should be collaborating with them.
Right.
Yeah, when we started doing the foundational community supports, we talked to Debbie Becker and with IPS and said, there's going to be a lot of agencies out there that aren't mental health agencies, and she referred us back to the Orange and Blue book, and that there is a very brief statement on one of the pages that talks about if it's not a treatment team, perhaps it's a support team, but everybody should have a team wrapped around them. It may not be mental health agencies, but it's whoever is involved in the person's life, including family members and things like that, but then whatever other agencies are involved.
Absolutely.
Okay, I don't see additional current questions right at the moment, so I'll just encourage you to either raise your hand, and in that case what happens is I'll unmute you like I did with Jamie, and you could ask the question verbally, or if you want to use the chat or the question box and actually type in what your question may be, that's absolutely acceptable too. So whatever works for you. So I will mention one of the things that we've done in the state of Washington as an aid to agencies, and I think you've seen this before too, Paul. We have a website that DSHS actually developed called Pathways to Employment. It's Washington state specific, and there is a link on the one side that talks about supported employment, and then if you look at the tabs across the top, one of the things is a tab that says forms. I like the ipsworks.org website. That library is a little bit of a beast. Excuse me for saying. There's like 170 items or something along that line. So one of the things that we've done is to pull some of the items that you might want to use as documentation, or at least as guides to develop your own documentation. And we've put it on the Pathways to Employment website. So like I say, it says on the Pathways to Employment website, the left-hand side will say supported employment in the list. And then the tabs across the top that open up, one of them will say forms. We have sample job search plans in there. We have a follow along support plan sample in there. We have actually a participant and job development log. The state of Washington, when they received a SAMHSA grant for transforming lives through supported employment, ended up developing the 2 best grant sites. And when Melody Paisolt, developed the 2 best grant sites, she actually developed an Excel spreadsheet that's got two tabs, one for participant, pretty similar to some of the examples that you showed, Paul, where it has names and first date of contact and first date of employer contact and, first job and wage and all those kinds of things. And then the second tab is a job development log where it has name of employer, who went out and talked to them, what's the follow-up needed, was it a hiring authority that you talked to, what was the name of the person, expected outcome kind of a thing. And so that a supervisor can go in and look at that and count the 1, 2, 3, 4, 5, 6. Look, this employment specialist did their 6 contacts for a week. It's super handy. And Fidelity reviewers with the participant log can look to see what was the first date of contact with the employment service team, and then what's the first date of going out and talking to an employer. So people don't have to develop their own form unless they want to. On that Pathways to Employment website, there are samples of various different things that they can use. I will say, and I didn't know until a couple of days ago when I was doing technical assistance with somebody who brought up the fact that the sample job search plan, any of the forms that say sample that are on the ipsworks.org website, are not fill-inable. And you can't delete the items to be able to use them to fill in. You actually have to perhaps use those categories and develop your own form with openings that you can fill in. So here I've been doing this work for as long as I have, and I didn't know that was the case. So I appreciated the gal that brought it to my attention. All right, does anyone else have questions? I heard somebody try and say something. Okay, the questions in the typed in questions in the question box are the same as they have been. I don't see anybody's hand raised right at this moment. I will say that Paul works for Public Consulting Group. We have 5 agencies with whom we've contracted to do technical assistance, and they're from across the nation. They've been contracted with in order to provide assistance to those of us that are trainers. In some cases to agencies. In some cases, they provide webinars or live training events or live training events at conferences or things along that line. Paul is an expert related to IPS fidelity reviewing, and we're hoping that Paul will be able to provide some training to agencies within the next year related to fidelity reviews and how to do them. So I'm hoping that will be the case, and if that's the case, you'll get to hear more from him over a period of time related to that topic. Other questions? Paul, how about you? Do you have some wrap-up kinds of items that you want to discuss?
Sure. Thanks, Dawn. I guess in general, I think if you look at the fidelity scale and you start to really evaluate all the things you need to document, it's really easy to kind of have systems overload and just shut the book and find something else to do for a couple minutes. So, it is, when I say, make it work for you, I really mean it. So there are certain values that, you need to be able to show and that sort of thing. The other side is, I'll just be real transparent with everybody too. There are agencies that they don't make it very easy on the fidelity reviewer, and that's not good or bad, and nobody gets any points knocked off for that or anything like that. But there are agencies that don't record all of this data, especially the ones that are calculations, like average number of days between, you know, first employer face-to-face and the start of IPS. There are agencies that kind of, they don't record it, so the reviewers have to go hunt for it and make that calculation based on, let's say, progress notes or something like that. And you can do that. Now, the kind of caveat I'll put out there is, you know, you're leaving a little bit of your score kind of up to what the reviewers can find when you do that. So I do mean it as I know I'm kind of wear my reviewer hat, but, you know, Dawn didn't say in my other job, my other life, I'm a guy who supervises IPS programs. So on that, with that IPS supervisor's cap on, you know, there's a start and an end to all of you. You all are busy. You all do wonderful work, and you may not have all of the time to put this on a silver platter for a reviewer, and that's okay too. Reviewers aren't going to come in and, you know, downgrade your fidelity score based on what you have the capability of producing for us. The most important thing is that we can get a number. So, and Dawn and I have talked about how I do fidelity reviews in general, and I'm never going to go into an organization and, you know, need to look at a particular value or number or whatever and leave without asking you for it explicitly. So if I can't find it as a reviewer, my responsibility then is to ask you to help me find it so that I can score it. So, you know, to me, fidelity reviewing is a partnership with an IPS provider, wherein we both, I mean, you're the ones that know everything about your agency. So, you know, you can't expect me to come in and know everything within 2 days. So I need your help as a reviewer to, you know, to find the things I need to find while I'm there so that I can give you the most fair score. So, you know, I know sometimes people hear like fidelity review and you can just see the kind of flash of anxiety on their face, but it is not intended to be an anxiety-inducing event. You know, the intention, again, is very pure. It's not like other surveys, audits, or visits from, you know, some accrediting source. It's just a different experience, and I'm really invested in making it a positive experience because the world is a better place if we have a higher number of IPS agencies that are high-performing. I'm a guy that started at a mental health center a bunch of years ago, and this is such a unique and neat way to provide recovery-oriented services to the folks we serve. You know, it's to everybody's best interest to try to help people get the best score they can get year over year.
Absolutely. It works. It absolutely works, and it provides not necessarily better outcomes in terms of quality, although it surely can because things are very individualized as they should be, but greater numbers of job placements occur if you use the principle, if you build the relationship with employers and with the person and with others that are working with them. It just makes a huge difference. You know, related to some of the tracking tools, whether you do IPS to fidelity, to good fidelity or exemplary fidelity or not, having been a supervisor of an IPS program, some of those tracking tools are godsends because you don't have to read each and every progress note as a supervisor in order to figure out what's going on with the staff. I was talking to somebody yesterday who said how, you know, trying to figure out what the person's doing, what the employment specialist is doing when they're out and about in the community. Well, some of these tracking tools give you the basis for knowing where they're at. If they've got 6 job development contacts in a day, you know kind of how they spent their day. The tracking for 65% of the time out in the community, if the calendar is done well and it shows they're out in the community and who they're with and that kind of thing, you really have a pretty good track of who's doing what. And from the standpoint of being an employee, when you're out in the community a lot, you want your supervisor to know what you're doing. You want to feel protected in the fact that they know that you're being productive and addressing the things that you should be. So even from that standpoint, some of these tracking tools are marvelous in regards to tracking time and documenting it so that everybody's on the same page.
Well, the last thing I'll say, Dawn, maybe as a plug, is for that December call where we're going to really explicitly talk about a fidelity review and how that goes.
Mm-hmm.
For folks on this call or on this webinar that have an interest in kind of demystifying that process, that's an opportunity for them to dial up and just kind of see the way they go in general. And,
Mm-hmm.
and I've been doing and again, just so people know, in case they don't believe me, I've been doing fidelity reviews for, it might be 6 or 7 years, at multiple organizations, and there's only been one that got contentious, and it really had nothing to do with the IPS team or the fidelity scale. It was about something completely different, and it just kind of happened in the backdrop of an IPS fidelity review. All of the rest of them, people have been very accommodating, and we spend 2 days with each other, and we leave. Everybody's happy with their score, and they feel it's a fair assessment. So,
absolutely. One other thing I would mention is we've done fidelity reviews of agencies, both for supported employment and supportive housing this year. Next year, we're going to do follow-up reviews. So in 2020, we're going to do follow-up reviews of the agencies that have an initial review. And we're going to incentivize, once again, volunteering to be agencies that host a review or plan to send reviewers. And so be watching for an email to come out. And we're talking about incentive amounts. For a hosting agency, we're talking about the idea of $10,000 to host a fidelity review, hoping to get agencies on board with wanting to do that kind of thing and defraying the cost of having staff kind of stand by to talk to fidelity reviewers and that kind of thing. So be watching for those incentive opportunities that come out to you in the not too distant future. I believe we were talking about December and January doing kind of an all statewide blast to see who might want to host a fidelity review. So that will be up and coming. I would encourage agencies, though, to consider the fact that a fidelity review just helps you with that continuous quality improvement, and it's a marvelous learning opportunity. Hosting a review, you learn a lot about fidelity. Going on a review, being a reviewer, being trained to do that, you learn a lot about fidelity. Going to a fidelity reviewer training, even if you don't do either one, you still learn more about fidelity. And the randomized controlled trials of IPS provide an awful lot of data that shows how well it works and why it works. So obviously I'm a proponent. I believe in it. I've seen it work very, very well. Are there other questions? Oh, I do see one other. Says, if we participated in the Fidelity Learning Collaborative in 2019, are we able to apply again for the incentive? There will be some incentives involved in participating in the follow-up review as well. So stay tuned for that, and actually maybe send me an email offline, and I can share some information with you about that. We haven't fully finalized what it is that we're doing. We're in our strategic planning process at this point in time, so I'm a little hesitant to give out a lot of information until we send out those emails. You're welcome. Any other questions? I don't see other hands raised, and we got Holly's questions answered. All right. So if there are no other questions, then we'll end a little early. You have some time back in your day, and I'm sure everybody's got things that they might want to do with it. Paul, did you have the other closing comments that you want to make before we sign off?
Not necessarily. These are good questions, and I understand that, some of you, this is kind of your first foray into employment services. So, keep an open dialogue, and I'm happy to answer questions. And I guess I'll just, Dawn, if there's something that floats to you that for whatever reason you're not sure, the right answer, or you want to talk with me about it, I'm always open to that. You know that.
Wonderful. Yep, I do. And I appreciate that. May I, and I have something up in the middle of my screen, so I can't see. Do you have your contact information on your slides, Paul? Are you willing to have people contact you directly with questions?
What I'd rather do is have them at least email you, and then we can talk about it. And the reason is sometimes people ask me questions that are, they're Washington specific, and I don't,
okay.
It's not my job to answer those. I don't want to say something wrong. So,
Understand.
yeah, I would prefer if you and I kind of in tandem review a question.
Okay, that's perfect. Makes a great deal of sense. All right, so not seeing other information, other questions, we're going to go ahead and end for today. I will be sending out the link to the recording and Paul's slides. And then if there's something that you expect to see or hope to see, in response to my email, the follow-up email, if say you need more information about ipsworks.org or whatever, just let me know and I will send that out as well. Otherwise, I think we're done for today. Thank you so much, Paul. I really appreciate your time and expertise. And thank you for all of you that attended. I appreciate that a great deal. I hope everybody has a marvelous day.
All right. Have a great day.
All righty. Bye-bye.
Bye.